Welcome to CEL-SCI's channel, dedicated to research and development directed at improving the treatment of cancer, autoimmune infectious disease. Joining us to discuss, we have Geert, Kersten here, the CEO. Welcome back, sir.
Well, thank you for having me.
My pleasure to get you on. So I want to dive right into this because in your pipeline, you're kind of tackling head and neck cancer as a lead indicator. For newer audiences, do you want to just give us an introduction, the brief elevator pitch to this aspect of your pipeline?
Sure. It's a horrible disease. It's the fifth biggest cancer in the world. It goes from under your nose down to your clavicle. They cut out your tongue. They cut half your face off. Radiation destroys your salivary glands. You lose your teeth. It's a horrible disease. We're focusing on the people who've just been diagnosed and will have the sick patients, stage 3 and 4, because the last approval that we know of from FDA for them was 1958 methotrexate. So clearly, this is a nasty disease. And the other thing that I want to emphasize is we want to tackle cancer differently. So we all know friends and family who've had cancer. Hopefully they were cured. But they undergo these horrible treatments, surgery and radiation and chemo. And then, oh yeah, my sister is cured. 6 months later, the sister has the cancer back. And 6 months after that, she's dead. That's how it goes too often, right? So how do you change it? You want to change it. We say you have to activate your immune system to fight the cancer while it's still healthy. What happens to your immune system when you do surgery and radiation chemo? It gets destroyed. So we're doing that. We're putting immunotherapy, activating the immune system to fight the cancer before surgery. It's called neoadjuvant. And in fact, as far as I know, we're the first in the world to have shown survival benefit, and definitely in this nasty cancer here.
Yeah, that's incredible. Do you want to discuss kind of where you're at from a milestone expectation, what kind of phase you're going into, and maybe just discuss the sector size and, how common of a cancer this is?
Well, it's the fifth largest cancer in the world, about 900,000 cases per year, and it's actually increasing. It's the main causes of smoking and drinking and HPV, human papillomavirus. So it's, you don't have to treat hundreds of thousands of people to create a successful company because the cancer drugs are so ridiculously expensive. We just don't know because the insurance companies pay, right? Many of the leading cancer drugs are $200,000. There are some that are costing $500,000. It's incredible. So our goal is to find those people who respond best to our drug, because if a doctor tells you that the drug works for everybody, it's nonsense. You've got to find out who it works best for, and hopefully you have an incredible survival with that. And it took us a while to figure that one out from our huge study, but we are actually presenting that data in about 2 weeks at a major European cancer conference.
Okay, so a little bit of milestones on that aspect. What aspect as well are you in from a phase trial perspective?
So we finished the phase 3 clinical trial, which is the last clinical trial. It was the largest clinical trial the world has ever seen in head and neck cancer, remember, from here to here. And we had very good results in patients who got our drug, surgery, and radiation. But when you added the chemo for patients that required chemo, and this was a doctor's determination, it didn't work, which to many people makes perfect sense because chemotherapy knocks down your immune system, right? Which our drug builds it up, chemotherapy knocks it down. So had the study been done without chemo, which wasn't possible because it's a doctor's decision, our data is so good, we probably would have been approved all over and probably would have been bought out for billions of dollars. That's how good the data is. But then there is this part where it didn't work with chemo in the same study, and no one's ever seen this. And so that's what we're discussing with regulators. We talked with the Canadians, and they said, go and apply for a conditional approval, which means you can come to market and then do a study. We talked with the FDA. We're still working certain things out with them. And we are soon going to be talking with the European regulators, which is by far the biggest market, and the British regulators also. We picked these 4 because they're the leading regulators. They recognize each other, so you get approval in one, the others often follow. And if you get approval in one of them, then others around the world will follow as well. So we've come a long ways. We are the first in, as far as I know, in literally decades to show improved survival. And we're talking a lot of survival. We're talking 4 years, almost 4 years of median overall survival extra, not months, years.
Very intriguing. But at this point, I will pass the question off to the viewers. We'd love to know what you think in that comment section below, and consider subscribing, because as this story evolves, we're going to bring it to you here. But on that, we look forward to catching you in the next one.